President Joe Biden has been diagnosed with metastatic prostate cancer at the age of 82. What does this mean? Well, prostate cancer is a malignancy. It's a tumor that grows in the prostate, and this is usually diagnosed in anywhere between 1 in 8 men. So it is a very common cancer in men. However, getting diagnosed with prostate cancer that has metastasized or spread to the bones is uncommon. In fact, it's only seen in 5 to 7% of cases. What we can glean from the news is that President Biden had what they call lower urinary tract symptoms. He was having trouble urinating. That could be difficulty emptying his bladder, straining to urinate, starting and stopping of his urinary stream. Maybe he was having urgency, frequency, going to the bathroom a lot. Now, these symptoms are very, very common. Most often, we diagnose prostate cancer in people who have no symptoms at all because of screening. This is a screenshot from the AUA guidelines for early detection of prostate cancer. And what do we recommend? We recommend that men should get a baseline PSA between the ages of 45 and 50 years of age, and they should get regular screening every 2 years or every 2 to 4 years between the ages of 50 and 69. Now, where do they come to these age groups from? We know that prostate cancer is very slow growing. So what this means is that when we diagnose prostate cancer, if we diagnose it within 10 to 15 years, you're likely going to have another poor outcome like death from heart disease or other problems before you get that prostate cancer to metastasize or spread to other areas of the body. Now, this is not always the case, but generally we can say if your life expectancy is less than 10 years, it is safe to stop prostate cancer screening. And the average life expectancy is about 77 years. So 69, that gives you 7 or 8 years of life expectancy for the average person. Now, I can't tell you when President Joe Biden was screened last, but ultimately you look at your screening numbers, you look at your PSA, how that's changing over time. You examine the prostate with a digital rectal exam. In this case, he did have a digital rectal exam and they found a nodule. Then they did a biopsy, which determined that he had prostate cancer. They then did some imaging to determine that the prostate cancer had spread. It's very unfortunate news, but thankfully prostate cancer is very treatable, even when it has metastasized.